today's discussion topic is a comparison between the classical formulations, such as the ones presented within the traditional Chinese medicine paradigm by INFINITUS, in comparison with some of the products that are presented to the world by certain network marketing companies. So let us begin, and you can see from the presentation, every slide that I've made available puts a description of the classics on the left and the moderns on the right. So let's begin our comparison. When you look at TCM products, it's easy enough to understand through a study of the paradigm that these are formulations designed for the wellness of the emperor, a very noble purpose, and one fraught with danger to the people who are doing the formulating. Because of this and the required demand for efficacy and quality assurance, these formulations tend to use ingredients and combinations that have been evaluated extensively. Over the course of hundreds of years, thousands, if not tens of thousands of practitioners trained in their art have used these formulations, experimenting with ingredients both in and out for the purpose of determining what works best, and they have treated millions of patients using these formulations. So everything that we now have within the INFINITUS lineup has been tested not just for weeks and months, but tested for thousands of years. We know they're going to work. When one looks at some of the comparable products from alternative companies, you can see that in many cases the formulations are not designed for the wellness of the emperor and the royal family. They are designed for the wellness of the company bank account. They are matters of expediency. And when ingredients are selected, it's not necessarily ones that work well in combination with the other ingredients in the product. They are frequently whatever the ingredient salesman that walked through the door happens to be pushing this month. Happens all the time. You might not believe it, but as a regulatory consultant, I often see products go through waves. When one company introduces a product with a given ingredient that has been not seen previously, it's very safe to say that within the next 3 months, there will be a dozen companies offering a nearly equivalent product. There's an awful lot of Me Too activity going on in this industry. When you look at the classics, it's very important from a formulation standpoint to consider the consequences for any practitioner that produces a bad product, a bad remedy, a bad treatment for the emperor, the members of his family, or those people favored by the emperor. The likelihood of severe punishment for failing to keep the emperor well is a very prominent aspect of the way these products are put together. Anybody who failed the emperor in terms of medical treatment would likely be either imprisoned forever or executed. The consequences are very severe. Look at some of the products and some of the companies that are also making things available in the modern world. When you look at the consequences for an MLM company that puts a bad product into the market, well, chances are there are no consequences whatsoever. Provided there are no immediate fatalities caused by a product, the FDA does not usually step in. The usual consequences for putting a bad product into the marketplace tend to be economic. If a product doesn't work, if there is no longer the illusion that there is benefit to be taken from the product, people simply stop buying it, which leads to the financial failure of the company. When we look at the classics, we can see, particularly from previous studies and previous discussions that we have all had during this call on the formulations presented by INFINITUS, it is evident that the ingredients and the combinations are well studied. The use of Ganoderma lucidum, for example, and ginkgo biloba is another example, go back hundreds, if not thousands of years. Modern formulations tend to be based on popularity. How often have you seen products with Hoodia gordoni or raspberry ketones? A better way to ask that question is to say, within the last 2 years, how often have you seen products with Hoodia gordoni or raspberry ketones? because these things tend to follow fads and popular trends, they rise and fall. Remember, we have always worked to describe the INFINITUS products as saying those ingredients, those combinations of products that work are retained. Those that do not work are abandoned. Well, again, how often these days do you see Hoodia Gordoni in anything? There's a reason for that. Let's go on to describe that. The classical formulations begin with folklore. There'd be a rumor floating around, usually in a village or in a small town by the practitioners, that they had used an ingredient with great effect and, safety in use and benefits to people's health. And so these ingredients would be looked at a higher level of scrutiny. Practitioners would get together and discuss their formulations that they were each using independently and compare notes and find that they might be able to improve upon those initial formulations by creating formulations. And so, once again, if it worked, it was kept. If it did not work, it was discarded. And so many of these formulations became enshrined in the classic textbooks that we've often cited. Some of these textbooks go back thousands of years, truly. And the interesting thing to me, for the most part, is that even when these classic ingredients like Ganoderma and ginkgo are examined to the contemporary gold standard clinical trial that I've been so often describing, that is placebo-controlled, double-blinded, crossover designs, everything needed to truly ascertain if an ingredient works, it has been shown that ingredients used by INFINITUS do exactly in these contemporary studies what the ancient texts said they would do. Really quite remarkable when you think of it. When the ancients wrote that ginkgo biloba would enhance your circulation and improve cognition, it's interesting to me that the modern medical community truly mocks the herbal industry, thinking it's a lot of voodoo. They say no controlled trials, it's really just speculation, everybody's guessing, testimonials mean nothing because anybody can say what they want to say. But there have been companies, there have been universities that put these things to the test, and ginkgo does exactly that. It improves peripheral circulation and improves cognition, and that's primary in the bee circulation aid product. It survived the ancient world's scrutiny through the practitioners all the way through modern clinical trials. You know it works. The same for Ganoderma. It was originally thought that people that consumed good quality Ganoderma for long periods of time didn't get as many infectious illnesses. They had an easier time coping with cancers. When these aspects of the biology of Ganoderma have been studied using modern clinical trial techniques, Ganoderma has been proven to do exactly that. The same holds true for every other ingredient. You've seen that in the past I have been quoting from the modern scientific literature about the benefits of these various herbs. The old classics hold up remarkably well. When we look at some of the modern ingredients that are out there, they all start in the same way. Somebody will issue an historical perspective on an ingredient and they say, this is worth putting into the product because it has been found that, ... They will go on to describe what some people have witnessed. But then we look at how they stand up to modern scrutiny. Well, some of these modern ingredients, these modern formulations, have made a few people very wealthy, but not so much because of the virtues of the ingredient or the product. This is more based on the ability of the owners of the network marketing companies to promote their products. It has often been found that when these ingredients are subject to the scrutiny of the modern clinical trial, they don't do what was originally anticipated. And we'll use Hoodia as an example. Let's go back for a moment and say that within the classics, these are sensible combinations. You can see that traditional Chinese medicine emphasizes the concept of herbs that support each other in a hierarchical structure. They say first there is the emperor herb, which has the primary role for the product. It's the one that accomplishes the main benefit offered by the product. In support of those, there are ministerial herbs, the ones that either make the original herb more bioavailable, ones that modify the chemistry a little bit to improve the efficacy of the product. And then there are ambassador herbs, which make the initial herbs safer or make them more subject to dispersal throughout the body system. And this goes on to lower levels of emissary herbs, which serve a lesser but still supporting function. We can see this holds true in such complementary formulations as the Royal Lingji Plus. Here we have a selection of mushrooms. Each one supports the function of the other, so that the totality of the product is a blockbuster effect in improving the human immune system. When we look at some of the modern formulations, the guiding principle seems to be that we could probably sell this stuff as a network marketing company if the compensation plan is good enough. That is, the compensation plan vastly outweighs the products as the priority, and because of this, there are some products made available that really should not be consumed at all. An example of this is one that Rob and I witnessed a few months ago when a company that was new to the industry came to us very excited about a product they had, and they said they felt this is going to be their next blockbuster. It would be the product that put them on the MLM map in this world. Well, when we looked at the formulation, we saw that it had 10 active ingredients. Remember, 10 ingredients that are supposed to do you some good. But upon further examination, we saw very clearly that of those 10, 5 of the ingredients were stimulants and 5 were sedatives. There were constituents within the same capsule that offset the suitability of other ingredients within the same product. It just showed that those who were putting this product into the market didn't really have an understanding of the product they were trying to sell. And I must comment that that company has already disappeared. When we look at the classics, there is a certain motivation to the preparation of the formulation itself. These things originated hundreds of years ago when there was no such thing as network marketing. Commercial interest did not enter the situation at all. They were formulated for the sake of keeping the population well. Because of this, these formulations were rooted in the collective wisdom of the practitioners. These are thousands of people, all with the same objective. None of it was financially motivated. All of it was motivated for the purpose of keeping their patients well. In modern times, there are companies that put out products formulated merely by the motivation of making money. The companies say, we have a blockbuster comp plan. Oh yeah, we're reminded we have to have a product to be sold in support of that, so anything will do. In some cases, we can see very clearly that these formulations are rooted simply in the need to keep the Food and Drug Administration or the Federal Trade Commission, or here in Canada, Health Canada, off the company's back. They're obliged to have a product in support of the comp plan to not be accused of conducting a pyramid sales scheme. And so whatever happens to be available, that's the product that comes to market. Now, we look at some of these ingredients, and let me give you a brief description of the histories of both Hoodia gordoni and raspberry ketones. Hoodia is a succulent plant. It resembles the cactus. It is native to Central Africa. In modern times, it has been used by the Bushmen of the Kalahari Desert. And these are people that even in the 21st century still lead a nomadic life of hunting and gathering. They're always on the move in an environment that is very hostile. When Western pharmaceutical types visited the Kalahari and asked the local people why they consumed the succulent leaves of the Hoodia plant, they said, it helps us suppress our appetites in times when we are on the move looking for food. Well, appetite suppression is a long way from weight loss, and that's what has been claimed for Hoodia gordoni. So the commercial history is equally interesting. At first, it was a small pharmaceutical company that had these original discussions, and somehow they arranged with the local government for the rights to develop Hoodia as a weight loss ingredient. This company didn't have the huge resources necessary to bring a drug to market from its initial concept, and so after a little bit of research, they sold it to a slightly larger pharmaceutical company who began investigating the composition of Hoodia for the purpose of weight loss. And that company gave up. They felt that they didn't make a sufficient number of suitable discoveries and eventually sold the rights to Hoodia as a weight loss ingredient to the very large pharmaceutical company, Pfizer. Well, Pfizer studied this for a few years. And, of course, being a drug company, they have a lot of money available for research. Well, as it turns out, I have a nephew whose mother-in-law is a biostatistician with Pfizer here in the Toronto area. And when I asked her what had become of the studies into Hoodia, she told me that Hoodia was such a disaster as a weight loss ingredient that Pfizer buried the results of its clinical testing so deep that even she couldn't get at them. Since that time, there have actually been a number of other published studies on Hoodia, and every one of them is almost apologetic in its concerns and its quotations. They say that they did whatever they could to study Hoodia as a weight loss ingredient, and it absolutely does not work. We apologize, dear reader, for wasting your time. And there have been several such studies. As mentioned previously in this call, when was the last time you saw Hoodia gordoni in any product? Well, a very similar story for raspberry ketones. Raspberry ketones emerged after Hoodia. That's a phenomenon that really only goes back 4 or 5 years because somehow raspberry ketones became a darling of Dr. Oz. He promoted it very heavily on one of his programs. As it turns out, he revisited it a short time later and continued to express the capabilities of raspberry ketones, as it turns out, also as a weight loss ingredient. Well, all of this was done based on one study done in a few mice, in which it turns out that raspberry ketones caused these mice to lose their appetite. Again, nothing done in humans, nothing done to the gold standard of clinical trials. Nevertheless, Dr. Oz promoted it on his show, and the market went crazy. For a long time, it was raspberry ketones in this and that and everything you can find. Well, once more, raspberry ketones by reputable scientists has been completely discredited as a weight loss ingredient. In fact, if you have any reason to look at the Health Canada's ingredient database, you will see that raspberry ketones are not approved as a weight loss ingredient. They're not approved as a medicinal ingredient of any kind. They are only approved as a flavoring ingredient. That's how severely discredited raspberry ketones are. And these fads will continue. There will be next year's common hot ingredient that nobody has yet heard of, but it will be its flash in the pan. One company will go into business promoting this, and they say it's the next greatest, best thing. And within a few months, a number of imitators will crop up and copy the product completely. It'll be just like putting Ganoderma in the coffee. How many companies do that? There's no originality to any of it. Well, you have the choice. You can deal in companies like that are more motivated by the comp plan, or you can stay with the TCM wisdom as presented by INFINITUS, which is only going to give you proven products that offer genuine wellness. You're in the right place. INFINITUS is making its adjustments to adequately cope with the demands of the North American market. They have a lot to learn. These demands are different than the way things work at home, but they are learning. Please be patient. Everything will work out just fine.